I'm Evie Dodge, and I am a first-year PA student here at Des Moines University. So a PA is a healthcare professional that can diagnose, treat, prescribe, manage illnesses, see their own patients under a supervising physician, and we work with our supervising physicians all the time, but we also get to practice autonomy in making healthcare decisions for our own personal patients. I can see myself working in almost any specialty. I was an athlete, so I love orthopedics and working with people in sports. My own OBGYN has made a huge impact on how I view healthcare, so I think women's health could be cool, but I also love kiddos, so maybe pediatrics.
Hi, I'm Casey Brown. I'm a first-year PA student here at Des Moines University. One of the things that I really liked about PA is that they work in areas that are medically underrepresented and in rural communities. I am a first-generation student, Hispanic, and I'm a part of the LGBTQ community. So for me, it's very important to work in these communities that have given so much to me. And so as a healthcare provider and as a PA, I do plan on working in rural medicine. I plan on working in LGBTQ healthcare, and I would prefer to live somewhere that spoke a lot of Spanish, just to give back to my communities.
Hello, my name's Nanavana Wright, and I'm a first-year PA student at Des Moines University, and I'm from Tallahassee, Florida. I'm a first-generation student, so I didn't have a lot of help from my family trying to figure out not only undergrad, but then a master's program, because none of my family had ever went into a master's program. So it was a big learning curve, but once you get there, it's very fulfilling. I would love to work in women's health, for example, something along the lines of Planned Parenthood or palliative care.
Hi, I'm Dallas. I am a physician assistant student at Des Moines University. I decided to become a PA because initially I wanted to find a career where I could help others. As I grew up in a family where my grandmother always helped others, I wanted to do the same. After graduation, I plan on working in cardiothoracic critical care. I've worked in cardiology for 3.5 years prior to starting PA school, and I've just grown passionate about the heart and the way it works.
My name is Jordan Vanderplug. I'm a PA student at Des Moines University. When I was a little kid, I moved from foster families a couple times. When I graduated high school, I was completely on my own. I paid for everything myself. And so doing PA school with 2 kids by yourself is not the easiest thing, but anybody can really do it. You just have to work really hard.
Hi, I'm Becca Christensen. I'm a first-year physician assistant student at Des Moines University, and I am from Hampton, Iowa, which is a really small town up north in Iowa. And I think one of the biggest struggles to finding out about the healthcare field and the profession of a physician assistant was just growing up in a small town, because I really didn't know what it was. We had a tiny little hospital that had a few doctors and nurses, and that was it. We didn't have any PAs, and so I went into college at Iowa as an undergrad 5 years ago, and I don't think I learned what a PA was until my 3rd year of college. I had realized by my 2nd year that I wanted to go into healthcare, and I was going between all these different fields that all had different aspects of them that I liked, but there wasn't a single one yet that I had found that seemed to fit everything together. And then I had a professor that had told me about PA and told me I should look into it, and so I did, and that was when I found the perfect career.
My name's Molly Pappin. I'm a first-year PA student at Des Moines University. I am originally from Minneapolis, Minnesota, if you're familiar with that area at all. And I chose to become a PA because I have a really big passion for primary care and for helping those in rural communities.
Hi, my name is Cassie Donahue, and I'm a first-year physician assistant student at Des Moines University. I enlisted in the Army Reserves when I was 17 years old because I didn't really know exactly what I wanted to do right out of high school, and then got accepted to the physician assistant program when I was 28 years old, and so there was quite a bit of time there. And so I would say that kind of taking that unconventional route and investing a little bit more of myself in some external opportunities through the military specifically were advantages and disadvantages at times. But ultimately, I'm grateful for the experiences and opportunities that kind of helped me hone in on what exactly it was that I wanted to do and helped me find the physician assistant program here at DMU.
Hello, my name is Zoe Au, and I'm a 2nd-year physician assistant student at Des Moines University. A physician assistant is a medical professional who diagnoses illness, develops and manages treatment plans, prescribes medications, and often serves as a patient's principal healthcare provider. I decided to become a PA because mental health is very important to me, and I feel that I need to be at my best to give my all to my patients. So I really like that physician assistants can change specialty because I still want to be interested in my profession in 20 years, and I want to be happy, and I want to be healthy, and I want to be able to use that energy to help my patients and really care about their treatment.
So one of the reasons why I chose PA and why I'm so excited about it is because we have the ability to switch specialties, which to my knowledge is the only healthcare profession that can prescribe and treat that can do that without having to go back and get board certified. So that was a big reason for why I chose PA, because I just want to work in everything, you know?
In 2021, the U.S. News and World Report ranked PA, the PA profession, as #1 for best jobs, #1 for best STEM jobs, and #1 for best healthcare jobs.
The average salary of a physician assistant is $112,260 in 2019.
PAs get the same medical training as physicians, about 80% of what physicians learn that PAs learn in half the time, and with a significant amount of less debt. So it's a very good profession for individuals to go into, especially to fill the gaps in medical care.
PA education is an accredited physician assistant program that leads to a master's degree after 26 to 28 months. It involves coursework as well as clinical work.
Schooling requires many hours of patient care experience. I know a lot of my friends in school have worked as patient care techs, nursing assistants, EMTs, paramedics, physical therapy aides, phlebotomists. So we have seen a lot of breadth within the healthcare profession, and I feel that that helps us go through school so quickly because we have already experienced some of the healthcare profession.
Where can PAs work? PAs practice in every work setting such as hospitals, urgent care centers, schools, and outpatient clinics. Physician assistant practice is centered on patient care, but may include educational, research, and administrative activities.
PAs are able to work in all sorts of specialties, including primary care, internal medicine, emergency medicine, pediatrics, the OBGYN, sports medicine, transplantation medicine, and surgical specialties.
PAs work in a wide variety of specialties, including surgery, first assisting in surgeries, and taking care of pre- and post-op patients. You can work in many specialties such as orthopedics, cardiology, general surgery, and many others.
Now, get back here. We need you.
PAs can work in a variety of different medical practices such as rural medicine in rural Iowa, where we're at now. If you follow me along, we'll go to our first patient of the day. Hello, I'm Casey Brown. I'm the PA today. How are you doing today?
Good.
How are you? I heard your tummy hurts. Did your tummy hurt? No? Does your elbow hurt? Does your eyes hurt? Oh, then what's wrong?
What is one word to describe a PA?
Diverse.
Friendly, patient-focused,
Compassionate.
Team player.
Competent.
Knowledgeable.
Minorities are underrepresented in PA programs and the PA profession, and increasing their representation is necessary for the effectiveness of the U.S. healthcare workforce. Research shows that patients respond better to providers who look like them and can relate to them culturally. Improving patient care. National PA organizations such as the PAEA and AAPA are working to increase diversity in the PA profession by providing resources and opportunities.
I would encourage anyone to become a physician assistant, and you are welcome.